Stuart. So good morning, folks, and welcome to the Qualitative Working Group June seminar. This is Kim Koester. I'm behind the screen. I apologize, my camera is not cooperating this morning. So for those of you who don't know me, I'm an assistant professor in the School of Medicine at UCSF, and I'm a co-director at the Center for AIDS Prevention Studies Methods Core. And I'm joined this morning by Julia McQuoid, who's also an assistant professor, but she is at the University of Oklahoma Health Sciences Center. And Julia and I run the Qualitative Working Group, and we would be really pleased if any of you on the line would be willing or interested in presenting in the Qualitative Working Group seminar series during the 2021-2022. That's starts in the fall, and we have different categories. You could present, you can bring us a works in progress, you can share findings from a study that's been complete and published, or complete and you want to give it a dry run for a conference. We're also always interested in having people do trainings on just basic qualitative methodological issues. So if you're an expert in grounded theory or phenomenology, eager to hear from presenters on those kinds of topics, focus group discussions, those kinds of things. So just FYI, we do like to have members of our group present to our group. So if you're interested, just reach out to us. But today we're offering this two-part seminar on criteria for evaluating and justifying qualitative methods in the health sciences. And the reason why we're offering this particular seminar, and this is the second time we're running it, is because we want to raise all boats, so to speak, in terms of, one, helping our quantitative colleagues become better educated about evaluating qualitative research, and then to support our qualitative colleagues in developing the skills to be, the best stewards possible of the qualitative enterprise, but also just to support our colleagues who are facing similar challenges. So this talk, we really see it as part of our effort to help educate prospective reviewers of qualitative grant applications or manuscripts to better understand how to assess quality. Because we don't want to be evaluated or graded based on criteria or worldview that's really not shared by qualitative researchers working in qualitative health research. So that's the backstory on this particular talk. So today's objectives, I'll talk briefly about when and why to use qualitative methods. And then I'll outline some of the current challenges. There are many challenges we could talk about. I'm just going to hit on a few that qualitative researchers face in terms of being evaluated based on criteria that really does not apply to qualitative research. Then I'll talk about different important areas for capacity building around the evaluation of qualitative research. And again, there's different areas we can't focus on all of them. So we've just selected a couple to talk about. And then I'm going to turn it over to Julia, and she is going to talk about the big, quote unquote, big 8 criteria for evaluating qualitative methods. And then in part 2 of this workshop, some of us will join a different Zoom line, and we will do more hands-on work to apply Tracy's big tent criteria to a qualitative research article. So looking forward to that second phase. Some of you will be joining us. So to begin with, let's talk about the when and why of qual methods. I, recognize so many of you on this call, so I know that this is information that is, that you don't need this information, but for those of you who are new to qualitative research, or just as a reminder to all of us, when is it that we reach for qualitative methods? Well, we do so when little is known about a topic, right? That makes sense. If we don't know that much about a topic, we would not know what types of questions to ask about on a survey, for example. Wouldn't know how to intervene in a particular health problem. Very often, though, qualitative methods, I would say, are used to study the contextual features of a phenomenon. For example, we really don't, or we're beginning to have more understanding of the context around vaccine hesitancy. particularly around, and then, yes, so particularly around vaccine hesitancy is just a contemporary issue that we don't know a lot about, don't really know about the context in which hesitancy operates, when and how people come to hold those views. Similarly, physical distancing requirements, when they weren't being followed, we could have made some assumptions and judgments about why people were not, following these kinds of, public health guidelines. So using qualitative research to dig in and really understand the internal logic of other people is useful. In my own research, I've studied the context of the use of HIV pre-exposure prophylaxis. That's the pill that prevents HIV. Really to understand the backdrop and the context in which people decide to use or stop using PrEP. And that's in large part because we have a very shallow understanding of the context of risk surrounding PrEP use. And so for me, my main area of study is around really troubling the ideas of risk. And so qualitative research really allows us to do that. But we can use it too when the boundaries of a domain are ill-defined. This again with vaccine hesitancy, where does the hesitancy begin and where does it end? We know if people are hesitant, they might move towards acceptance. So trying to understand those boundaries is important. When a phenomenon is not quantifiable, we would use qualitative research. And when the status quo may be poorly conceived and a topic needs to be re-examined. And here I will call on the work that Julia and I are involved in together, and that is around poly-tobacco use. And so the status quo for a long time has been, focused very much on combustible tobacco. So cigarettes were smokeless tobacco. And now there are many other kinds of things that can be consumed. And the context has really shifted. So what is the role of tobacco these days? And maybe in California, now that cannabis is legalized and that there is a very wide variety of, electronic nicotine devices, vapes, widely in use. So that status quo around tobacco use is changing, needs to be re-examined. In all of these examples, qualitative research endeavors to seek an in-depth contextualized understanding of complex processes, experiences, and phenomenon. Janice Morse, she's one of my favorite qualitative health researchers, says excellent qualitative inquiry is a leap into the unknown. And this just brings us back to, the when and why of qualitative research. You really, who would have known that this beautiful rainbow would have been inside this cake? So, but there are, the reason why we're here is to talk about these problems that qualitative researchers face. And in particular, we want to hone in on these two things, that grant review committees may not have sufficient qualitative expertise represented. And therefore, many, or in addition to that, many reviewers on, we do a lot of NIH research at CAPS. Reviewers may not then know that quantitative and qualitative research have very different evaluation criteria, And then second, quantitative criteria then are often used to evaluate qualitative research. And that might mean that we have poor scores on our grant applications or poor scores around our qualitative approach. It could be that, we are criticized for having too small a sample size in our manuscripts, and our manuscripts may be rejected. So qualitative work may be denied for really inappropriate and invalid reasons. And that is why we're here today, to try to help educate these prospective reviewers to understand the criteria by which one should be measuring the quality and rigor of qualitative research. So let me talk about a few of the things that come up again and again, right? For those of you who are in this room, I know you know this. I know you have faced these kinds of issues. So you can also feel free to chime in and give examples, maybe a recent example of when you faced this and how that was for you and maybe how you worked through that. So this topic of sampling is perennially asked about by students, mentees. Does someone want to make a comment? I'm not able to really see, but I can hear. No? Okay, great. Okay. So, I mean, right, how many people have asked you, Julia, or you, Emily, you know, how many people should I include in my study? How do I ensure my sample is not biased, right? We get these questions a lot. This is a really important question for students of qualitative research. How many people should we include? So let's start with this, with addressing the issue of bias. And the premise goes like this. A, qualitative research is biased. B, that bias is antithetical to the research enterprise. C, therefore, qualitative research is not trustworthy, right? So bias is universally perceived as negative and absolutely something that you work against in research, but that's definitely not the case for qualitative researchers. We are most definitely biased. We actively, knowingly, purposefully, intentionally seek to sample the best, however we define best, cases for inclusion in our studies. And it's not something that we need to or should apologize for. Our work, our sample is biased by design. So this is a big point to try to be making over and over again to people. So when we intentionally select cases for inclusion in our study, we call this purposive or purposeful sampling. There's other strategies to sample though. They include snowball, typical, convenient sampling. Yes, qualitative researchers definitely use convenient sampling, maximum variation. These are just a few of the other types of options that qualitative researchers use. But under certain conditions, it's really gold standard to go for purposeful sampling. And that is when you're really trying to select the most information-rich cases. And that is to ensure that because we work with small samples, that our sample will be maximally productive and it will produce a rich data set based on a few people, right? But in reality, we may not know where to locate or how to identify information-rich cases. That's okay. That's when we rely on convenience, typical, maximum, these other kinds of sampling strategies. But there's ways that you can try to detect the quality, I'll say, of a potential informant. You can do this through screening. You can screen people for, you know, your basic eligibility criteria, but you can also be on the lookout for, you know, things like, is this person talkative? Does this person have sufficient experience with the phenomenon under study? Are they vaccine hesitant, right? Are they able to explain and share details with you? You can ask some, you know, softball questions during your screening to see, you know, how open is this person, and that can give you just a sense about the potential for the person being an information-rich case. When you can't do that, then you increase your sample size, and that will help you to offset the interviews that are less information-rich. So there are ways we can get around this gold standard of purposeful sampling. But I want to come back to the point that we really do handpick our participants when possible. And so when you're, I'll say, accused of being biased, that's a clear sign that education really needs to happen. And sometimes just explaining how you derived your sample can help to at least offset some of the criticism. So then this question about determining sample size and achieving saturation, there's no magic bullet here. The sample size depends entirely on one's research question and the population that you're seeking to study, but it is also very much hinges on your budget. So there are unknowns. There's some general advice that we can provide, and I think those of us who, you know, write up qualitative work for a living, I think many people rely on the Guest and Bunce article, which talks about how many interviews are enough. So this is in regard to interviews. And Guest and Bunce suggests that if the group that you are looking at is homogeneous, you will probably learn, you will have a sufficiently rich data set by 10 to 12 individuals. The more heterogeneous your group becomes, then the more people you would need to sample. So that's sort of a rule of thumb. And then I will just caution to say that Janice Morse, going back to Janice Morse, she says that, you know, the idea of saturation, and this idea of saturation is, you know, you're not really learning anything else once you get to that 12th person who looks a lot like the 11th and 10th and 9th person. That notion of saturation assumes that there's nothing more to learn. And she disagrees with the sentiment of saturation. So I think saturation is really useful in health research. We need something to guide us to end our, you know, to call it, so to speak. And I think saturation is a fine idea, but I just wanted to put out there that, you know, we don't want to turn it into this black and white situation that, you know, our study is sufficiently powered, so to speak, because we've saturated on notions of vaccine hesitancy among these 15 people. So just to call that out. When you're writing a grant and you need to generate ultimately need to generate a sample size using the language of up to, we will sample up to, you know, 30 people, 40 people. Doesn't box you in, but you do have a number then to work with in terms of your budget. So does anyone want to say anything about sampling or sample size here before I move on? You can jump in later. Okay, next I wanted to just talk about grounded theory. If you were in Carol Camlin's amazing talk last month, you know that this came up in Carol's talk. And this is really about the misapplication of grounded theory. So those of us who are reviewing or reading qualitative articles, we know that grounded theory comes up a lot. You know, I would say it comes up too often, and that it's used as shorthand, really as a way, generally speaking, to describe one's analytic approach. I myself, and I think my colleagues, raise an eyebrow really whenever grounded theory makes an appearance. And that's because grounded theory requires this highly specialized methodological knowledge. And it is very time intensive, and grounded theory is difficult then to do well in the context of applied health research. We don't have a lot of time. Our studies do not afford us the time that I think really would allow for a rigorous grounded theory study. I'm not saying it can't be done. Sure, it can. But there are some things that need to be in place if I'll say you're going to get past me as a reviewer. So if you, as a reviewer, are reviewing an application or a manuscript that that includes language around grounded theory, especially used in terms of the analytic approach, you can assess the sincerity of the grounded theory aspirations by asking a few key questions to yourself. You know, does this team include someone with expertise in grounded theory? You know, looking at a bio sketch of someone, oh, they were trained at UCSF in the sociology department. That is where grounded theory was born. Yes, I bet they have really great expertise around grounded theory, really good training in that. Or, you know, look at their list of publications. Can you tell, did have anything, you know, has grounded theory come up in any of the titles? So, or are, you know, members of the team described as having experience with grounded theory? So this is one way you can assess that. The other, I think, very obvious thing is, does the grant application seek to develop a theory about a phenomenon or social process? Does the manuscript present a theory? Hey, if you adopted a grounded theory approach, then I would like to see a theory presented. And sadly, that doesn't always happen. It seems like a pretty straightforward, you know, A plus B, but no. If you want to use grounded theory, I want to point you to Hallberg's. This is an article that Julia found recently, and we both really liked it. It provides a really useful list of the fundamental characteristics of grounded theory. So we just wanted to point you there. If you're a fan of grounded theory and you want to know, you know, do a little, just to check with yourself to see, am I really doing grounded theory? Check out Hallberg's. And the last time we ran this group, we were at the Tobacco Center sitting around a table with a pretty small group of people. And We know that these real world reviewer comments go over really well. They serve as, it's, good case example of the kinds of things that Julia and I are talking about in this. And so we just have a few examples. This real world reviewer comment comes from an AMH R21 application. And this is from reviewer one. Reviewer one says, the sample is biased given that all men who have sex with men, that's MSM, participants, will be recruited from health department clinics and STI programs. This approach excludes men who have sex with men who receive care in other settings and limits the generalizability of the findings. Yes. Sample is biased and it limits the generalizability. These are the kinds of things that drive qualitative researchers crazy, right? So let's talk about generalizability. Qualitative research valorizes depth. So why evaluate us based on breadth, right? Generalizability is not an explicit or implicit goal of qualitative research. It's not a standard we would like to be held to. It just is not, it's completely inappropriate. This is one of the things that is so highly inappropriate to accuse us of and to score us lower because our findings aren't generalizable. No, they aren't. However, our findings, we do strive for transferable findings. And this is the language that qualitative researchers use. If you do not use this language as a qualitative researcher, I want you to encourage you to think about using this notion of transferability. And that concept is really all about, would our findings fit in other contexts? So to go back to this point that reviewer one made, that our sample of gay men who are drawn from health department clinics or STI programs, that they're really very different from men who have sex with men who were seen in a private clinic. Not sure. We could talk about that as a potential limitation. Sort of depends on the findings, right? To know whether or not we could say that we feel our findings would be transferable to men in other health contexts, but maybe they are transferable. I would say oftentimes our qualitative findings are transferable. So transferability is our notion of generalizability. And so let me end there with my little rant about generalizability. Almost through with these slides before I turn it over to Julia. I'm going to talk a little bit about analysis. So qualitative data analysis is really a black box, and it's often reduced to discussion of coding one's data. So I think this is particularly true when people write up their manuscripts and a reviewer is evaluating the qualitative analysis, and reviewers will really glom onto criticism about, coding, or perhaps that's all the manuscript, the authors of the manuscript describe is about their coding process. But analysis is so much more than coding. And sometimes it doesn't even involve coding. So this is where I think things become really tricky, because qualitative data analysis is in large part very interpretive, and describing interpretive processes is challenging. It just is. And that's why I think reviewers and authors sort of overemphasize coding. But I've had reviewers come back to me and ask, was there any coding framework predetermined or developed? Basically asking, to what extent is, were the codes deductive versus inductive? Was there a final code book on which transcripts were coded? In general, how many coders were there? Wasn't there an inter-rater measure? So a lot of attention on coding, and I would say an overemphasis on coding. And that's because people, I think, are really grasping for evidence of, validity. Did this team go through a valid process to identify these themes or identify this theory? And when we switch over to Julia in a moment, I would say that Tracy, the criteria, the 8 Big Tent criteria, are so much more consequential in evaluating a manuscript or a grant proposal. So before I turn it over to Julia, let me just say that in the end, you really cannot please all of your reviewers sitting around a grant review table. And here's just an example taken from a mixed method study, and the qualitative section approach was designed by me, and reviewer 2 says, use of qualitative methods to truly understand the experiences of individuals, blah, 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 will be critical in better understanding the process of such and such. This section is well described and clearly will result in interesting and important information in red. They go on to say the use of participant observation was a particular strength of the qualitative data. But then we move to reviewer 3, and reviewer 3's perspective is the real goal of an expected outcome / use of the ethnographic work is extremely unclear. In other words, it is not clear what will be gained from it. So these 2 reviewers are just, reading through very different lens. This is a fine criticism from reviewer 3. It's important to be explicit about what we hope we will learn. So I, don't take too much issue with reviewer 3's comments. That's great. Yes, explaining ourselves more clearly is always going to be a benefit to us. But there's just such a sharp contrast here between reviewer 2 and reviewer 3. Reviewer 2 really gets it, and those of you who are writing grants and being rejected, this kind of thing I think feels familiar. You know it when your reviewer really gets your work, and those who do not get your work. Okay, so let me stop there and turn it over to Julia, who will talk about Sarah Tracy's great paper.
Great, thank you, Kim. So I just want to add that somebody was asking about the guest article, and we're after this we'll email out a list of the different resources that we've been talking about. So that'll come to you in your email. So this is the final kind of half of this hour that we'll be talking about these 8 big tent criteria that Sarah Tracy has developed. And this isn't meant to say that this is the only standard of criteria that should be applied to qualitative research by any means. There's at this point quite a bit of published criteria for evaluating qualitative research. But the reason that Kim and I like this is that we think that it provides a common language of best practices that can be used and applied to a variety of different qualitative methodologies. So in the quantitative community, there's well-established aims for validity, reliability, generalizability, and objectivity. In the qualitative research community, there's such a diversity of qualitative methodologies that come with this diverse set of concepts and discussions around how to evaluate our work. So the purpose here is to provide a common language that we can use in evaluating and in justifying our work. And I want to invite everybody to unmute yourself at any point, and please just jump in and provide examples of what you consider to qualify as fitting these criterion, or examples of where you've seen work that hasn't done this, or just if you disagree with any of these criterion, jump in and let's have a discussion. Oh, sorry, Kim, I have to ask you to forward. I forgot that I'm not in charge here. Okay, there we go. So the first of these criterion is we ask ourselves, is this a worthy topic? So this is relating to the so what of our research. Simply filling a research gap or confirming an existing assumption is insufficient. Worthy research topics emerge from disciplinary priorities, as well as timely societal events or even personal events within researchers' own lives. Research that is counterintuitive, questions taken for granted assumptions, or challenges well-accepted ideas is often worthwhile. So in short, we want to be asking ourselves, is this topic interesting rather than is this topic obvious? So an example could be, a researcher proposes to do an in-depth qualitative study of young adults' experiences using e-cigarettes. And at this point in time, there is a pretty healthy body of literature, qualitative literature on young adults' experiences with e-cigarettes. And the only unique thing about the proposal is the geographic setting. So in my mind, the researcher would really have to make a compelling argument for why it would be the case that their findings could present something that would be different from what's already in the literature. And if anybody wants to chime in with an example of, work that they've seen that they thought was kind of like a obvious, well, duh, that's obvious. Anybody? Okay, moving on. So the next criterion is rich rigor. So rigorous qualitative research is marked by a complexity of abundance. And this is in contrast to quantitative research that is valued and appreciated for its precision. So good qualitative research requires a requisite variety of theoretical constructs, data sources, contexts, and samples. So as Tracy says, and I love this quote, a researcher with a head full of theories and a case full of abundant data is best prepared to see nuance and complexity. So researchers should evidence due diligence, exercising appropriate time, effort, care, and thoroughness throughout the research process. So we're looking for thoughtful, careful, transparent research that is not cutting corners or taking the easy way out at the expense of qualitative methodological processes and data. So an example that I've come across in reviewing an article was an article where the author said that they had conducted 30-minute interviews with participants who had type 2 diabetes. And they were claiming to have collected, rich, abundant, complex, nuanced data on so many different domains within those 30 minutes that to me, it just did not seem plausible. So they were saying that they had asked participants about everything from their relationships with their healthcare providers, their diets, their physical activity routines, and how type 2 diabetes had affected their relationships with their families, how it affected the interpersonal dynamics with their families, just on and on. So the depth of knowledge that would be possible to obtain across all those different domains within 30 minutes seemed pretty questionable, suggesting a not very rigorous approach to collecting data. Also, the constructs used within this article were pretty poorly defined, which to me suggests weak rigor during the analytic process. I just really want somebody to chime in and give an example, but if they won't, then I'll just continue on.
Julia?
Yes.
Well, I will chime in and say that I was listening to the different domains and that the diabetes team was asking about, and you can absolutely cover that ground in 30 minutes. And for those of us who are in the field a lot doing in-depth interviews, we know that one or two of those domains could take 30 minutes to get into. So I guess I just want to say that, yeah, I think if you have a novice interviewer who has not been able to shadow someone doing, a very thorough job as an interviewer, it would be possible to execute those questions and to have a data set to work with. It's just the question here is, okay, well, what kind of data are they working with?
Yeah. Yes. No, I agree. I'm sure they ran the interviews, but in my mind, the question is how rich is the data that they're working with, and that they're deriving their findings from. All right, let's go on to the next criterion. So the next is sincerity. So unlike the Wizard of Oz depicted here, who Dorothy discovers is, actually a man behind a curtain, just, operating some levers and pretending to be all powerful. As researchers, we really have to demonstrate transparency and self-reflexivity, especially about our subjective values, biases, and inclinations. So what do we mean by self-reflexivity in talking about qualitative research? So really, we're talking about having an honesty and authenticity with ourselves about who we are and what we bring to the table when we are engaging in qualitative research, including our biases and inclinations. So a big part of qualitative research is this interpretive process, as Kim has talked about, that goes into both collecting and analyzing the data. So having this sincerity and self-reflexivity is very important. So I think it's worth noting that no research is atheoretical. It's basically impossible for anybody to go into an interview or to, look at interview transcripts with a kind of a blank slated mind. So we're all swimming within a social and historical context that informs our way of thinking about any topic. So the more clear that we can be with ourselves about what we're bringing to the table, the more that we can produce sincere research. Sincerity also includes transparency about the methods that we used and the types of challenges that we faced during the research process. So for example, if you're doing interviews with participants of some sort of a health intervention, and due to funding limitations or restrictions, those interviews were conducted months and months after the intervention actually ended. It's important to not only be transparent in reporting that there was that gap, but also to consider and lay out for the reader all the different kinds of consequences that there could be for them in interpreting your findings based on what happened. All right, I think I'll just continue along. Go ahead, Kim.
I just jump in here and I think we will soon see in or have already seen in manuscripts that we're reviewing discussion of the challenges brought on by COVID. And so I think that could be, we could capitalize on this moment that, how is it that we can be transparent about the challenges that we've faced in carrying out our research on so many different levels due to COVID, and talk about that in our method section, talk about that in the implications and limitations sections, that could be a call to action to, moving forward, let us be free to talk about the challenges that we faced. I think that is possible. It's possible to have a paragraph in the method section that explains some of the tricky, sticky things that we have faced. And it would, yes, it just helps to build trust between the reader and the authors, because there's some truth telling going on, because you are lifting the curtain. But it also just helps other, readers to feel not alone. Oh, I have also struggled with that particular challenge of that time lag that you just mentioned, Julia, between the end of the intervention and interviewing people too far and forward and their memories too vague. I would really appreciate it if people would talk about challenges more often, I think is what I'm saying.
Yes, could I just add? Yes. I totally agree with you, Kim. Sometimes the challenges you encounter are incredibly illuminating about the field you're in. Sometimes you might be finding a lot of roadblocks put in front of accessing the people you want to talk to, or accessing documents that they have and they don't want to share, and this kind of thing can be really helpful in understanding the field and polarizations and conflict within the field and reasons for secrecy and all these kind of things can be really illuminating. I talk about it a bit in my book about some of the doctors I wanted to talk to. I won't go into it now, but it's pretty, it opened up a whole aspect of the picture that I hadn't been aware of.
That's great, Sarah. Thank you.
Thank you, Sarah. Kim, when we were getting ready for this, we had this, for me, very interesting conversation about self-reflexivity. And I confess I'm pretty darn delinquent in my publications and being self-reflexive. So I was wondering if you could say a few words, and if anybody else would want to chime in of examples that they've seen of really excellent self-reflexivity in publications, or just what you ideally would want to see from authors.
Yeah, and I know that there are people on this call who have something that they could contribute. I'll just say that reflexivity is very much a part of one's training as an anthropologist, to be positioning oneself and to be transparent about our position vis-a-vis the context in where we're carrying out our research, the people in which we're interfacing with. It's hard to do in writing and publishing for medical journals. And at minimum, I like to tell the reader that I'm a white woman with my disciplinary background is in anthropology, I also like to talk about the extent to which my experience in, to talk about the duration I've been in the field of qualitative research, to just also position that I have a lot of knowledge and authority, that should signal that maybe I'm a, good interviewer and can collect very rich stories, maybe. But the ways in which that I wish authors would do, at sort of at minimum, is to talk about the people on the team as human beings with identities that will shape how they are interpreting qualitative data. So I really would appreciate more discussion of who is a part of the analytic team, and I would just say that we definitely try to practice that on the papers that I'm a part of. It makes such a difference to be working with a really diverse team in the field that I'm working in on HIV prevention, and specifically focused very much on gay men, people who I am not like at all. I have to be working with other gay men to help sensitize me to issues. And we can have really great discussions about, what you might hear in an interview versus what I might hear in an interview, right? So I think at minimum, explaining some of the identity that people bring to the work is important, but I'd love to hear from others.
Is there anybody else on the call who would want to chime in?
Hey, it's Emily. Kim, I really appreciate your reflections about taking a broader approach to reporting out, and also just considerations around self-reflexivity as well as positionality, even in building out research teams. And so one of the things I think is very important in the arena that we work in around HIV, as well as other health-related conditions, is deliberately bringing in community members, often from the very communities that we work with, and integrating them into the team, from the point that you're designing the data collection instruments through data collection itself and the analysis as well.
Yeah, thank you, Emily. That's so great. I mean, Julia, not to put you on the spot, but it's always been sort of remarkable and notable to me as I've been getting involved in the poly-tobacco world and doing interviews with people who use different substances, that we don't talk about whether the research team consumes these things or doesn't consume these things, or what kind of judgments we may hold about them, and whether we're harm reductionists or we're people who hold a firm line around abstaining from these things. So to me, I feel like that's something that the tobacco field could really benefit from more discussion about. Well, yes, you can be critical of the industry and the health harms that come from these products, and you can be highly sympathetic to the user's perspective. So I think you can do those two things at once. But it's just, I know I've read transcripts where our participants have asked the interviewer, have you ever done this, right? Have you ever done, dabbering, what it is? Jewel, have you ever jeweled, right? And so there's not very much discussion about the behaviors, and whether researchers, like where the research team comes down on these things. Do you try to recruit interviewers who have experience with these devices because they have intimate knowledge, right? So I'll just say, because I study sex, it's a little different, harder to kind of be very explicit about these things in the hiring process, or even during the interviewing itself, right?
Yeah. No, you're totally right. And I was just like, while you're talking, the only publication I know that there are more, but there's only one publication I can think of where the author was really explicit about their own relationship to smoking. And it was because it was a piece that she wrote on what it was like to be doing tobacco research as somebody who was smoking at the time. and what that was like for her. But other than that, yeah, it's just not a practice within tobacco research literature. I know Marshall Cheney's on the call. I don't know if you have come across anything else that I'm forgetting, but yeah, it's an area for improvement. And like I said, see, this is why I love doing these seminars with you, Kim, because it's like, these are opportunities for me to have self-reflection and look at my own work and say, oh yeah, like that's something I'm not doing very well. So I completely own that I'm terrible at doing this in my work currently.
Well, I think it's just that it's not conventional. It's not conventional yet. It's very conventional in ethnographies. You would have a whole chapter on positionality if you were writing a book, but it's just, we're not there yet. And we can get there though. We can push ourselves and we can push our colleagues to situate themselves.
And Kathy Dwyer just said in the chat, there's this big challenge of dealing with page limitations, and that's a whole other thing for sure.
Yes.
All right, next slide. I don't want to go too far over because I want time for us to have discussion at the end. Okay, so next criterion is credibility. So this is really having to do with showing rather than telling in reporting your findings. So providing enough detail, usually this is in the form of quotes, so that the reader can come to their own conclusion rather than the researcher telling them what to understand from the data. Triangulation and crystallization can also enhance credibility. So using multiple types of data, multiple researcher viewpoints, theoretical frames, and methods of analysis to provide a more thorough, although sometimes contrasting, interpretation of the data. So an example would be when multiple researchers are engaged in a dialogue about the interpretation of the data, rather than having one individual on the research team who's in the interpretive process of analyzing the data from beginning to end. And there are disciplinary differences around that, but at least in the health sciences, I definitely see that as something that reviewers want. Multivocality is another way to enhance credibility. So this is a genuine inclusion of participants' interpretations and viewpoints in addition to the researchers' interpretations and viewpoints. So this is, for example, if I'm reading an article and I'm noticing like, hey, the quotes that the author is giving me to substantiate their points is kind of like from the same three participants over and over again, I might start to doubt the credibility of how this researcher had interpreted the data. Like, what other voices am I not hearing that are conflicting with the story that the researcher wants to tell? And member reflections. So sharing and dialoguing about study findings with participants, getting their reflections on how they react to your interpretation of the data. So an example of this, and it's funny, I feel like I keep on providing negative examples but rather than positive. So if anybody has positive, please jump in. I was reviewing an article about a therapeutic gardening intervention, and the authors were arguing that a key component of the success of the intervention was that it was able to create a safe space for participants to have this therapeutic experience, but they provided no quotes from participants themselves actually saying that. So, to substantiate their claim. Okay, next. The next criterion is resonance, and this is personally one of the, Michael has a comment. The lack of reflection is really a problem in the alcohol research field. Okay, maybe we can revisit that at the end. So resonance, this is one of my favorites. So qualitative research should not only be accurate, it also must have aesthetic merit. So the text needs to be presented in a way that is evocative so that it has an impact and moves the reader to think and feel differently. So transferability is also part of this. So does it have the potential for the findings to be valuable across multiple contexts or situations? So an example would be, and I'm thinking back to my dissertation work, some dimensions of patients' experiences managing chronic kidney disease within the workplace may have relevance to patient experiences managing multiple sclerosis in the workplace. So there could be a transferability of those findings to a different setting. Naturalistic generalization can also enhance resonance. So this is good research and good writing that provides readers with a vicarious experience. So an example of this could be, instead of being told by the researcher that weekly dialysis is highly restrictive on one's life, through your writing and use of evocative quotes, the reader can experience the feeling of being tied down in time and space by this treatment modality. All right, let's go to the next one. Yeah, we've got 8. Okay, the next criterion to ask ourselves is this, do these findings provide a significant contribution? Do they extend knowledge or change the way we approach a problem? Do they build theory? Do they improve practice, generate ongoing research, advance methods? Is there heuristic significance to these findings? So in other words, does it move people to further explore, research, or act on these findings in the future? Does it help inspire new discoveries and develop curiosity and interest in the topic? And so, one way of doing this is to provide substantive and interesting suggestions for future research. And I just gave an example here of the Kearns 1993 article, which in my field as a health geographer was kind of like one of those publications that just really kind of catalyzed a whole new way of thinking and doing in my field. And I doubt I'll ever have a paper like that in my entire career, but I can strive for, in my own modest way that my findings will move forward either conceptually, practically, methodologically, or heuristically. All right, Kim, next. Ethical. So is the research ethical? So procedural ethics is the one that we think of the most often. And, in shorthand, this is basically IRB compliance. But we also think about and talk about less in our writing situational and relational ethics. So in situational ethics, Tracy calls it the unpredictable, often ethically subtle, important moments that come up in the field. So these are moments when we have to ask ourselves, do the means justify the ends? So an example that I thought of, which is actually more about reporting findings, is even if your IRB approval will allow you to present case level data in an article, are the measures that you've taken to protect the participant's identity commensurate to the sensitivity of the topic? So for example, if you're talking about illicit drug use, does the means justify the ends? Relational ethics has to do with researchers being mindful of their character, actions, and consequences on others. So for example, during an interview, if a participant refers to a topic that could bring up traumatic thoughts or memories for them, you have to ask yourself in that moment, do I probe about this during the interview? How important is that story that person could tell to my research question? Did they appear upset when they brought up the topic, etc.? And then exiting ethics. So this is about how researchers leave the scene and share their results. So how do we represent participant stories in a way that they do more good than, we have to ask ourselves if we are representing participant stories in a way that would do more damage than good. So for example, stories about poor or vulnerable people are told, the way that they are told may further stigmatize these populations or portray them in disempowering ways. All right, we're rounding up on the top of the hour and we've got the last one. So meaningful coherence. So studies that are meaningfully coherent or, articles eloquently interconnect their research design, data collection, and analysis with their theoretical framework and situational goals. So for example, if a paper is presenting a theoretical or conceptual framework and really, helpful, rich literature in the introduction, but then it doesn't pull that through the interpretation of the findings and the discussion, then it's not very coherent. Or in another example, which I've encountered in reviewing an article, if the research aim that is stated in the introduction is not supported by the methods, then that's another way that it's not coherent. So for example, reviewing a paper where they said that they were going to research barriers and facilitators of managing a particular disease, and then in the way that they talked about sampling, they were only recruiting participants who were reporting having difficulties with managing their disease. So then you think, well, then how are they going to get those rich stories about what facilitates management of that disease? All right, I made it to the end. Kim, if you wouldn't mind forwarding to the next slide. So I just wanted to say that we will be sending out this list of various criteria for evaluating and justifying qualitative research in case it's useful for anybody. So it's the top of the hour. Kim, how do you want to transition and or open up for discussion?
Well, I think I just want to say thank you, Julia, that you have always done an excellent job presenting Sarah Tracy's criteria. I love that paper. I hope you all will read it or file it away for future use. why don't we spend 5 minutes here for those of you who want to stay and can, and then we will transition into our other Zoom room for the workshop portion. And we can, happy to take questions or wish you a happy Wednesday. Thank you for coming.
Thank you, Jason. Thank you, Summer. If people want to, you know, pretend like we're in real life, you could turn on your videos.
I wish I could.
Oh, yeah, you can.
Darn it.
I know, it's very strange.
I'm going to try again. Nope.
Hi, Summer.
This is slightly off point, actually. It was first say, yeah, incredibly helpful and very succinct and articulate. Fantastic presentation by both of you. Thank you. But also, Kim, you gave a really excellent talk to the CFAR people. Is there a chance that could be part of the qualitative working group? Because I thought that was really great and, you know, really crystallized a lot of issues about qualitative research.
Yes, and I think we could potentially do a panel. So I'll just say that that talk was about writing up qualitative research. Yes. And you know, so some practical advice on approaching just approaching the writing process, and which could be applicable to, you know, writing up both quantitative and qualitative. So just some moral support there, and then just some practical advice on thinking about the different sections. And yeah, so it was a talk about writing up qualitative data. And Sarah, I know I thought that you would have something important to contribute if we were to do it next time. Michael and Julia, I think it could just be really fun to talk about our, if we have specific strategies that we use. I don't know, let's talk about it offline about how to potentially organize a session on writing up qualitative data. I do think that is an area where people really do need help in education. So thank you for that suggestion, Sarah.
Good idea.
Yeah.
Marshall, I see you on there. Are you still with us?
Yes, sorry, my connection is not that good, so I turned off my video.
You're fine. I just wanted to say hi.
Yeah, and I think writing up the suggestion to write up about how to write up qualitative research is a great suggestion, even particularly for different disciplines, or even for like NIH funding proposals. Because I think that the way qualitative is communicated to people outside the field, I think can really make or break, you know, whether people understand what it is that you're trying to do, or what is rigorous or what is not. So I think that would be a great topic.
Great. Good. All right. Well, we've got the second hour. Should we take like a 5-minute break and then come back?